Endometriosis is a chronic, painful disease that's often tricky to diagnose. There are three main symptoms: painful periods, painful intercourse, and infertility. We sat down to learn more about what it is and what to do if these same symptoms affect you.
The best way to explain endometriosis, although there are other theories of how it originates, the most accepted theory is retrograde flow. So what that means is that the tissue, part of the tissue that is released with a woman's menstruation each month, a portion of that backflows through the fallopian tubes and implants in the pelvis. Again, there are other theories, but that's the most widely accepted one. And the implants have different types of lesions. They go from being fresh to coagulated to ultimately scar tissue, and the staging of endometriosis is based on extent of disease. So stage 1 being the mildest form, stage 4 being the most aggressive. The milder stages can absolutely impact both pain symptoms and fertility, and the way that it does that is because those lesions release inflammatory substances, and so when a patient is having their menstruation, those lesions are also bleeding inside of the pelvis, and the molecules and substances that are released are extremely inflammatory to the pelvis, specifically the peritoneum, which is basically a layer that covers our intestines, and can cause that pain that most patients complain of. Endometriosis as a disease is considered a surgical diagnosis. So technically, if you're going by the book, there's a laparoscopy required. Basically, we put a little camera in through the belly button and look inside for lesions, and in that way we're able to diagnose the disease. Outside of doing that, what a lot of people will do, even ourselves as infertility specialists, to treat pain symptoms is basically an empiric treatment of 3 months. So we give the patient a trial of 3 months of hormonal suppression. Typically that's done with oral contraceptives or birth control pills. And if patients report improvement in their pain symptoms, then the suspicion for endometriosis goes up. So it's highly suspicious when those symptoms improve. So a lot of patients aren't excited about going to surgery, and this may be a less invasive way of trying to assess for the disease. Specific with fertility, it's a little bit different conversation. The surgical diagnosis still remains as an option, particularly for patients who are not well controlled on birth control or whose pain symptoms are affecting daily life. They're calling out of work, they're not able to be intimate with their partners. So definitely that still has a role, but for the fertility patient, the goal of obtaining a pregnancy precedes controlling any other symptom. And in those cases, we tend to counsel them on fertility treatments before we discuss surgery. I would say if it's something that's bothering you enough to impact quality of life, or if it's something that has been progressively worsening with time, then it's absolutely something that needs to be addressed. It may not be endometriosis, but certainly that should be one of the things that is looked at.
It's important to note that even following a diagnosis and treatment, endometriosis can recur. Dr. Sweldo recommends patients maintain hormonal suppression to keep symptoms at bay.